Question 1. Topic: Animal behavior and communication. John is the owner of a dog, Max, who has recently started exhibiting aggressive behavior whenever other dogs approach him during walks. John is concerned about this behavior and wonders what you should do to help Max. Based on what you know about animal behavior, what is the most effective way for John to address this issue? A. Immediately punish Max when he shows aggression to discourage the behavior. B. Avoid walking Max around other dogs to prevent any incidents of aggression. C. Gradually expose Max to other dogs in controlled environments to help him become more comfortable. D. Keep Max on a leash at all times, but allow him to interact freely with other dogs without control. Answer: C. Explanation. The most effective way to address aggression in dogs, particularly in situations involving other dogs, is through desensitization and counter-conditioning. This involves gradually exposing the dog to other dogs in controlled environments, starting at a distance where the dog feels safe. Over time, this can reduce anxiety and fear, leading to a decrease in aggressive behavior. This approach is much more effective than avoidance or punishment. Punishment, option A, can increase fear and stress in dogs, potentially worsening aggressive behavior. Avoidance, option B, may prevent incidents in the short term, but doesn't address the underlying issue and can cause the dog to become more reactive in the long run. Allowing uncontrolled interaction, option D, dangerous and is unlikely to help the dog learn proper socialization techniques. Question 2. Topic: Health and disease management. In a shelter, a kitten named Lucy is brought in with a mild fever, nasal discharge, and loss of appetite. After a thorough examination, the veterinarian suspects a viral infection. What should be the immediate course of action to manage Lucy's condition? A. Begin immediate treatment with antibiotics to combat the infection. B. Isolate Lucy from other animals and administer supportive care such as fluids and nutrition. C. Continue to monitor her condition and wait for symptoms to resolve without intervention. D. Immediately vaccinate Lucy to prevent further illness and reduce symptoms. Answer: B. Explanation. Given the symptoms described, Lucy is likely suffering from a viral infection for which antibiotics, option A, would not be effective as they are only useful for bacterial infections. The correct course of action is to isolate Lucy from other animals to prevent potential transmission and provide supportive care, e.g. fluids, proper nutrition, and possibly antibiotics to help her recover. This approach will help the viral infection while her immune system fights it. Waiting for symptoms to resolve, option C, without intervention can put Lucy at risk of complications, especially if she has a weakened immune system. Vaccination, option D, is important for preventing future illnesses, but would not be effective in treating an existing viral infection. Question 3. Topic: Animal welfare and ethics. Scenario-based question. Sarah is a volunteer at an animal shelter and is asked to clean the dog kennels. While cleaning, she notices that one of the dogs, Daisy, appears lethargic, has diarrhea, and seems to be in distress. What should Sarah do first to ensure Daisy's well-being? A. Continue cleaning the kennels and wait for the shelter supervisor to return for further guidance. B. Immediately isolate Daisy from the other animals to prevent the spread of any potential infection. C. Report Daisy's condition to the shelter supervisor and wait for instructions on how to proceed. D. Attempt to treat Daisy's condition herself with medication available at the shelter. Answer: B. Explanation. In this situation, immediate isolation, option B, is the most critical action. Daisy may be showing signs of an infectious disease, and isolating her from other animals is crucial to prevent the potential spread of the illness. It is important to follow the shelter's protocols for handling sick animals, which typically involve isolating them to reduce the risk to other animals. Waiting for the supervisor, option A, could delay crucial for Daisy, especially if her condition worsens in the meantime. Reporting Daisy's condition, option C, is important, but immediate isolation should take priority while awaiting guidance. Attempting to treat Daisy, option D, without proper veterinary training or supervision could worsen her condition and potentially harm her. Question 4. Topic: Nutrition and feeding practices. A local pet store has recently started selling specialized dog food that claims to be complete and balanced for adult dogs. This food is labeled as having all the necessary nutrients. However, a customer asks for advice on whether this food is suitable for their senior dog, who is 10 years old. What should you recommend? I advise the customer to continue feeding the senior dog the same food, as it meets all the nutritional requirements for adult dogs. B. Suggest a change to a senior dog food that is designed specifically for older dogs with different dietary needs. C. Recommend that the customer feed the senior dog less of the current food, as older dogs need fewer nutrients. D. Tell the customer to add supplements to the dog's current food to compensate potential deficiencies. Answer B. Explanation. As dogs age, their nutritional needs change. Senior dogs often require food that is lower in calories but higher in specific nutrients such as joint support, glucosamine, easily digestible proteins, and antioxidants. Senior dog food, option B, is formulated to address these specific needs which may not be met by regular adult dog food. Continuing with the current food, option A, may not address unique needs of an older dog, especially if the food is not designed for senior dogs. Feeding less food, option C, may be necessary for weight control, but it does not address the need for specialized nutrients that senior dogs require. Adding supplements, option D, may not provide all the necessary nutrients in the correct balance and could be risky without a veterinarian's guidance. Question 5. Topic: Animal reproduction and breeding. In a breeding program, a female dog is observed to be in estrus showing signs of increased vocalization and restlessness. The breeder intends to mate her but is concerned about her readiness. What is the most accurate indicator of when to breed the female dog for the best chances of successful conception? A. Mate her immediately since she is showing signs of estrus. B. Mate her after 7 days from the beginning of estrus when she is most fertile. C. Mate her only when she stops showing signs of estrus, indicating the end of her cycle. D. Mate her once her appetite decreases, indicating the peak of estrus. Answer B. Explanation. Female dogs are most fertile during the peak of estrus, which typically occurs 7 days after the onset of estrus. During this time, ovulation occurs and the chances of conception are highest. This window is essential for successful breeding. Mating immediately, option A, at the beginning of estrus is too early as ovulation has not yet occurred and the dog may not be receptive to mating. Mating at the end of estrus. Option C is too late as the female's fertility has declined by this point. Appetite changes, option D, are not reliable indicators of fertility or the timing for mating. Question 6. Topic: Animal welfare and ethics. A pet store owner receives a shipment of puppies from a breeder, but some of them appear to be malnourished, have eye infections, and seem lethargic. According to animal welfare standards, what is the store owner's first responsibility upon noticing these issues? A. Sell the puppies at discounted rate to encourage quicker sales. B. Contact the breeder to return the puppies and demand refund. C. Immediately isolate the puppies and seek veterinary care to address their health concerns. D. Keep the puppies in the store, continuing normal sales procedures while monitoring them for any changes. Answer C. Explanation. The store owner has a legal and ethical responsibility to provide proper care for the puppies and ensure they are in good health before being sold. The first priority is to isolate the puppies to prevent the potential spread of illness and seek immediate veterinary care. Option C. To treat their infections and malnutrition. Selling a discounted rate, option A, does not address the health issues and can compromise the puppy's well-being. Returning the puppies, option B, may be necessary later, but the immediate concern is the puppy's health and ensuring they receive the necessary care. Continuing normal sales procedures, option D, without addressing the puppy's health is unethical and potentially illegal as it puts the animal's well-being at risk. Question 7. Topic: Animal shelters and rescue operations. A rescue organization has just received a group of stray dogs, several of which are pregnant. The organization is considering whether to sterilize the pregnant females before adoption. What ethical considerations should be taken into account before making this decision? A. The sterilization procedure should be carried out to prevent unwanted puppies, as it is more important to reduce the number of homeless animals. B. The welfare of the pregnant dogs should be prioritized and sterilization should only be considered after the puppies are born and weaned. C. Sterilizing the pregnant females could harm the puppies, so it should never be done. D. Sterilizing the pregnant females is unnecessary as they should be given the chance to reproduce before being sterilized. Answer B. Explanation. Ethical decisions in animal welfare must prioritize the well-being of both the mother and the puppies. Sterilization, option B, should be considered only after the puppies are born and weaned, as performing the procedure during pregnancy could risk the health of both the mother and the unborn puppies. Reducing homeless animals, option A, is an important goal, but it should not come at the expense of the health of the mother or her puppies. Sterile. Pregnant females, option C, can be harmful if done too early, and ethical standards generally advocate for allowing the puppies to be born before any medical procedures are carried out. Allowing reproduction, option D, is not an ethical choice as it leads to more unwanted puppies, contributing to overpopulation and potentially worsening the welfare of animals in shelters. Question 8. Topic: Animal anatomy and physiology. During a routine examination of a horse, the veterinarian notices that the horse appears to be suffering from a respiratory condition with labored breathing and nasal discharge. Based on your understanding of animal physiology, which part of the respiratory system is most likely affected? A. The lungs are most likely affected, causing difficulty in oxygen exchange. B. The nasal passages and sinuses are likely inflamed, causing blockage in discharge. C. The diaphragm is most likely not functioning correctly, reducing breathing efficiency. D. The trachea is most likely obstructed, preventing proper airflow into the lungs. Answer B. Explanation. Respiratory conditions in horses, such as labored breathing and nasal discharge, are commonly linked to inflammation or infection of the upper respiratory system, which includes the nasal passages and sinuses. Option B. These areas can become congested, leading to difficulty breathing and discharge. The lungs, option A, are also important, but this would typically present with more severe symptoms such as coughing or wheezing, just nasal discharge. The diaphragm, option C, is responsible for breathing, but a respiratory infection typically affects the upper respiratory system first. Obstruction of the trachea, option D, is less likely in this scenario as it would cause more severe respiratory distress and difficulty inhaling, which is not indicated by the symptoms described. Question 9. Topic: Animal legislation and regulation. In a veterinary clinic, a new client comes in with a rescued exotic animal, a species that is classified as endangered under international law. The client asks if they are legally allowed to keep the animal as a pet. What is the appropriate response based on animal protection laws? A. The animal can be kept as a pet if it is legally acquired as long as the owner meets the animal's care needs. B. The animal can be kept as a pet only if the owner has the proper permits and the animal is not endangered. C. The animal cannot be kept as a pet as it is illegal to possess any endangered species. D. The animal can be kept as a pet as long as the owner agrees to take responsibility for its breeding. Answer C. Explanation. According to international laws, such as the Convention on International Trade in Endangered Species of Wild Fauna and Flora, cites it is illegal to own, breed, or trade in endangered species without the appropriate permits. In this case, keeping the animal as a pet, option C, is prohibited, regardless of how it was acquired, unless the owner has specific legal documentation and permits that comply with endangered species. Protection regulations. Legal acquisition, option A, does not exempt the owner from the restrictions placed on endangered species. Permits, option B, may be required, but endangered species are generally not allowed as pets under most circumstances. Responsibility for breeding, option D, does not alter the legal restrictions on owning endangered species. Question 10. Topic: Animal health and disease prevention. A veterinarian notices that a group of puppies has started to show signs of a contagious viral infection, such as lethargy, loss of appetite, and vomiting. The vet suspects that the infection is caused by parvovirus. What is the most effective method of preventing the spread of this viral infection in a kennel setting? And administering antibiotics to all dogs in the kennel as a precautionary measure. B. Quarantining infected dogs and disinfecting the entire facility to prevent further contamination. C. Allowing dogs to continue interacting freely as the virus will naturally disappear within a few days. D. Giving all dogs a one-time vaccination to ensure immunity against parvovirus. Answer B. Explanation. Parvovirus is highly contagious, and the most effective method of controlling its spread is to quarantine infected dogs, option B, to prevent them from coming into contact with healthy dogs. Disinfecting the facility is also essential to kill the virus on surfaces. Antibiotics, option A, do not treat viral infections like parvovirus. Allowing dogs to interact, option C, would increase the risk of spreading the virus. Vaccination, option D, is important for long-term prevention, but it will not help in the immediate outbreak scenario. Question 11. Topic: Animal behavior. A dog owner reports that their dog is excessively barking at visitors, pulling on the leash, and showing signs of anxiety when left alone. Which of the following behavioral training strategies would most likely address the dog's anxiety? A. Implementing positive reinforcement by rewarding the dog for calm behavior when visitors arrive and when left alone. B. Scolding the dog for excessive barking and rewarding only when the dog stops. C. Using a shock collar to correct the barking and pull-in behaviors immediately. D. Ignoring the dog's anxiety and hoping it will resolve on its own as the dog matures. Answer by explanation. Positive reinforcement, option A, is a highly effective method for addressing anxiety and undesirable behaviors in dogs. By rewarding the dog for calm behavior when visitors arrive or when left alone, the dog will begin to associate these situations with positive outcomes, reducing anxiety over time. Scolding, option B, is counterproductive and could increase anxiety. Shock collars, option C, may cause more harm, exacerbating the dog's anxiety and stress. Ignoring the problem, option D, is unlikely to resolve the behavior and may worsen the dog's anxiety. Question 12. Topic: animal nutrition. A pet food company is introducing a new line of grain-free dog food. The company claims that it will improve the dog's overall health by eliminating grains from the diet. What is the most accurate response regarding the use of grain-free diets for dogs? A. Grain-free diets are superior for all dogs and should be used to prevent food allergies and improve digestion. B. Grain-free diets are only necessary for dogs with specific grain allergies or sensitivities. C. Grain-free diets are always preferable to regular dog food for preventing obesity. D. Grain-free diets are not recommended as they can cause protein deficiencies in most dogs. Answer B. Explanation. Grain-free diets, option B, are beneficial only for dogs with specific grain allergies or sensitivities, which are relatively rare. Most dogs can tolerate grains such as rice or oats without any issue. Grain-free diets, option A, are not necessarily superior for all dogs, and eliminating grains does not guarantee better health for most dogs. Grain-free diets, option C, are not inherently better, preventing obesity, and may even be higher in fat or calories, depending on the ingredients used. Protein deficiencies, option D, can occur with an improperly balanced diet, but grain-free diets are not generally associated with protein deficiencies if formulated correctly. Question 13. Topic: animal welfare laws. A local animal shelter is facing overcrowding and is considering euthanasia as a solution for dogs that have been waiting for adoption for several months. According to animal welfare laws, what is the most ethical action the shelter should take before considering euthanasia? A. Euthanize the dogs to reduce overcrowding and free up space for new arrivals. B. Reach out to other shelters and rescue organizations to transfer the dogs to other locations where they might be adopted. C. Allow the dogs to remain in the shelter indefinitely as there are no legal limitations on shelter space. D. Immediately advertise the dogs for adoption at a low price to encourage faster sales. Answer B. Explanation. Before considering euthanasia, option A, the shelter should reach out to other shelters, option B, and rescue organizations to transfer the dogs to locations where they have better chances of being adopted. This is a more ethical solution and can help save the animals' lives. Euthanizing the dogs, option A, should be last resort after all other options have been exhausted. Allowing the dogs to stay indefinitely, option C, is sustainable and does not address the issue of overcrowding effectively. Lowering adoption fees, option D, might help in some cases, but it doesn't directly address overcrowding or the dog's chances of finding a good home. Question 14. Topic: veterinary medicine and diagnostics. A horse is showing signs of lameness and the veterinarian suspects a soft tissue injury. What diagnostic tool would be most appropriate to confirm the diagnosis and assess the extent of the injury? A. X-ray imaging to identify fractures and bone damage. B. Ultrasound imaging to assess the soft tissues, ligaments, and tendons. C. Blood tests to detect signs of infection or inflammation. D. CT scan to analyze internal injuries in detail. Answer B. Explanation. Ultrasound imaging, option B, is the best diagnostic tool for assessing soft tissue injuries, such as those involving ligaments and tendons. It provides real-time imaging that allows the veterinarian to visualize soft tissue structures and determine the extent of the injury. X-ray imaging, option A, is effective for detecting fractures and bone issues, but not soft tissue injuries. Blood tests, option C, can provide useful information on inflammation or infection, but cannot directly diagnose soft tissue damage. CT scans, option D, are typically used for detailed examination of bones and internal organs, but are less effective for soft tissue assessment compared to ultrasound. Question 15. Topic: Animal handling and safety. A handler is preparing to move a large group of sheep into a new pen. The sheep are known to be nervous and may react aggressively if startled. What should the handler do to ensure the safety of both the sheep and the handler during this process? A. Use loud, sudden movements to herd the sheep quickly into the pen to minimize the time spent in the process. B. Slowly approach the sheep using calm, deliberate movements and avoid sudden noises to prevent frightening them. C. Force the sheep into the pen using a strong rope or leash to ensure they stay in the pen. D. Allow the sheep to roam freely without any guidance, and they will find their way into the pen on their own. Answer: B. Explanation. When handling nervous animals, especially sheep, it is essential to use calm, deliberate movements. Option B. To avoid startling them. Sudden movements or loud noises can increase stress and may lead to aggressive behavior. Loud, sudden movements, option A, will likely escalate the sheep's stress and make the situation more dangerous. Forceful handling, option C, can cause physical harm to the animals and should be avoided. Allow sheep to roam freely. Option D, without guidance, could lead to confusion, stress, and may not result in them entering the pen safely. Question 16. Topic: Animal reproduction and breeding. A breeder is preparing to make two dogs to produce a litter. The female dog has just entered her estrus cycle and the male is showing interest. However, the female is very young and the breeder is concerned about her physical maturity for breeding. What is the best action the breeder should take? A. Proceed with the mating, as the female is already in estrus and able to breed. B. Wait until the female is at least 2 years old before allowing her to mate, as this will ensure she is physically mature enough. C. Mate the female dog immediately, but ensure that the male is older and experienced in breeding. D. Mate the dogs, but limit the number of litters the female can have to avoid any health risks. Answer: B. Explanation. It is critical to wait until the female dog has reached full physical maturity before breeding, which is typically around 2 years old. Option B. Breeding too early can lead to complications in both the mother's health and the litter's viability. Proceeding with the mating, option A, could result in health problems for the young female, as she may not be physically ready to carry litter. Age and experience of the male dog, option C, are less relevant than the maturity of the female in ensuring safe pregnancy. Limiting litters, option D, is important for the health of the dog, but does not address the issue of the dog's readiness for pregnancy. Question 17. Topic: Animal welfare and ethics. A pet store receives a shipment of reptiles, including a species known to be highly sensitive to temperature fluctuations. The store staff is instructed to place the reptiles in enclosures that may not meet their required temperature ranges. What is the most ethical course of action for the pet store to take regarding the care of these reptiles? A. Proceed with the placement of the reptiles in the enclosures and hope they adapt to the temperature conditions. B. Immediately inform the supplier about the temperature concerns and request better suited enclosures for the reptiles. C. Keep the reptiles in suboptimal conditions temporarily and monitor them until they can be moved to more appropriate enclosures. D. Sell the reptiles to customers as soon as possible to avoid the risk of them being kept in unsuitable conditions. Answer: B. Explanation. The ethical responsibility of the pet store is to ensure the welfare of the animals, which includes providing an environment that meets their specific needs, including temperature requirements. Informing the supplier, option B, and requesting appropriate enclosures is the most responsible action to protect the reptiles from potential harm. Placing the reptiles in unsuitable conditions, option A, is unethical and can lead to significant problems for the animals. Monitoring the reptiles in poor conditions, option C, might not be sufficient to prevent harm, and it is best to act proactively to address the problem. Selling the reptiles quickly, option D, does not address the animals' welfare in the store and could result in the animals being improperly cared for by customers. Question 18. Topic: Animal anatomy and physiology. A veterinarian is performing a routine examination of a rabbit and notices that the rabbit has dental malocclusion, a condition where the teeth do not align properly. Which of the following best explains the physiological impact of dental malocclusion on rabbits? A. Malocclusion causes difficulty in chewing, leading to digestive problems and potential weight loss due to inadequate food intake. B. Malocclusion causes pain in the jaw but has little impact on the rabbit's overall health. C. Malocclusion can result in tooth decay but does not affect the rabbit's ability to eat or digest food. D. Malocclusion causes infections in the teeth but does not lead to any long-term health consequences. Answer A. Explanation. Dental malocclusion, option A, in rabbits can severely impact their ability to chew food properly, leading to digestive problems, potential weight loss, and difficulty obtaining sufficient nutrition. Rabbits have continuously growing teeth, and misalignment can cause the teeth to grow abnormally, resulting in further complications. While it can be painful, option B, it directly affects digestion and overall health in significant, not just the jaw. Tooth decay, option C, is not the main concern with malocclusion. The primary problem is impaired chewing and digestion. Although malocclusion can lead to dental issues, option D, it poses much broader risks to the rabbit's health, especially if untreated. Question 19. Topic: Animal environments and housing. A zoo is designing a new enclosure for a species of primate known for its high level of intelligence and social behavior. Which of the following considerations is most important when designing the enclosure? A. Ensuring the enclosure has high walls to prevent the primates from escaping. B. Creating an environment that includes structures for climbing, foraging, and socializing to simulate the primate's natural habitat. C. Installing variety of food dispensers to ensure that the primates do not need to forage. D. Limiting the number of primates in the enclosure to reduce stress but not prioritizing social interaction. Answer B. Explanation. Primate species with high intelligence and social needs require an enriched environment. Option B, that encourages socialization, foraging, and climbing. This helps replicate their natural behavior, promoting their well-being and mental stimulation. High walls, option A, are necessary for safety but do not address the animal's behavioral or social needs. Food dispensers, option C, may reduce natural foraging, which are essential for the animal's mental health. Social interaction, option D, is critical for these primates, and limiting their number without prioritizing social interaction would not be suitable for their well-being. Question 20. Topic: Animal health and disease management. A farmer notices that a group of cows in the herd is displaying signs of lethargy, reduced appetite, and increased body temperature. The cows are also showing symptoms of respiratory distress. What is the most likely cause of these symptoms, and what should the farmer do? A. The cows are likely suffering from a viral infection. The farmer should immediately isolate the affected cows and contact a veterinarian. B. The cows are likely suffering from heat stroke. The farmer should immediately move the cows to a cooler area and provide extra hydration. C. The cows are likely suffering from a nutritional deficiency. The farmer should change their feed and monitor their condition. D. The cows are likely suffering from stressed overcrowding. The farmer should reduce the number of cows in the herd and wait for them to recover. Answer A. Explanation. The symptoms described: lethargy, reduced appetite, increased body temperature, and respiratory distress are consistent with viral infections such as bovine respiratory disease (BRD), which can affect cattle. Immediate isolation of the affected cows and contacting veterinarian, option A, and necessary steps to prevent the disease from spreading. Heat stroke, option B, may cause similar symptoms, but the combination of symptoms suggests an infection rather than environmental heat stress. Nutritional deficiencies, option C, might cause lethargy or poor appetite but would not typically result in increased body temperature and respiratory distress. Stress from overcrowding, option D, can impact cattle health, but the symptoms here are more indicative of disease. Question 21. Topic: Animal training and behavior. A dog trainer is working with a dog that has a history of aggressive behavior toward other dogs during walks. The trainer uses positive reinforcement by rewarding the dog when it remains calm and focuses on the trainer instead of reacting aggressively. What is the principle behind this approach? A. Positive reinforcement encourages the dog to associate calm behavior with rewards, gradually reducing the aggressive behavior. B. Positive reinforcement teaches the dog to ignore other dogs entirely, removing any motivation to interact. C. Positive reinforcement punishes the dog for aggression, leading to fear-based obedience. D. Positive reinforcement involves rewarding the dog only when it behaves aggressively, reinforcing unwanted behavior. Answer A. Explanation. The principle behind positive reinforcement, option A, is to reward desirable behavior, calmness, focusing on the trainer to encourage the dog to repeat that behavior. Over time, this can help reduce the dog's aggressive responses by making calm behavior more rewarding. Teaching the dog to ignore other dogs, option B, may not address the root cause of the aggression and could limit the dog's socialization. Punishing the dog for aggression, option C, may result in fear or anxiety, which is not an effective method for resolving aggression. Rewarding aggression, option D, would exacerbate the problem and reinforce the undesirable behavior. Question 22. Topic: Animal nutrition. A veterinarian is advising a pet owner on feeding their adult cat. The owner is considering switching from a commercial dry food diet to a raw meat diet. What is a key consideration the veterinarian should address before recommending a raw meat diet? A. The raw meat diet may lack the essential nutrients required for the cat's health, particularly taurine, which is vital for heart health. B. Raw meat diets are universally recommended for cats as they more closely resemble the diet of their wild ancestors. C. The raw meat diet will likely improve the cat's coat condition and reduce the need for additional supplements. D. Raw meat diets are unsuitable for cats as they lead to an increase in diet issues and should be avoided entirely. Answer A. Explanation. While a raw meat diet, option A, may seem appealing due to its natural appeal, it often lacks essential nutrients such as taurine, which is crucial for the cat's heart health and overall well-being. Taurine is not abundant in all raw meats, and the diet could lead to nutritional deficiencies. Raw meat diets, option B, can be risky if not carefully formulated and may not meet all of the cat's nutritional needs. Coat condition, option C, may result from certain nutrients, but raw diet does not automatically provide balanced nutrition. Digestive issues, option D, can occur with any diet that is not balanced or properly handled, but are not blanket consequence of raw diets. Question 23. Topic: Animal enrichment. A zoo is housing a group of elephants that are known for their high intelligence and strong social bonds. To enhance their well-being, what is the most important enrichment practice the zoo should provide for these elephants? A. A large, secure enclosure with ample space for roaming and a variety of environmental stimuli, such as logs, water, and vegetation for exploration. B. Regular visits from human trainers to interact with the elephants and provide them with entertainment. C. Daily walks on a leash with the zookeepers to ensure that the elephants stay active and engaged. D. Providing the elephants with a constant supply of food and water without requiring effort to obtain it to keep them well fed at all times. Answer A. An explanation. Elephants are highly intelligent and social animals, so the most important enrichment practice, option A, is to provide a large, secure enclosure with ample space and environmental stimuli that encourage natural behaviors such as foraging, climbing, and social interaction. This promotes their mental and physical health. Human interactions, option B, can be valuable but should not be the primary form of enrichment. Walks, option C, are not practical or appropriate for elephants as they are large, wild animals that require more space. Providing constant food and water without effort, option D, deprives elephants of the opportunity to forage and engage in natural behaviors. Question 24. Topic: Animal breeding and genetics. A breeder is planning to mate two dogs to produce a litter of puppies. One dog has a history of hip dysplasia in its family, and the other has no known genetic issues. What is the best approach the breeder should take to minimize the risk of passing on hip dysplasia to the puppies? A. The breeder should mate the two dogs as the risk of genetic issues is low because one dog does not have a history of hip dysplasia. B. The breeder should ensure that both dogs have been tested for hip dysplasia before mating and use the results to inform their decision. C. The breeder should avoid breeding both dogs and look for mates with no genetic history of hip dysplasia. D. The breeder should proceed with the mating but avoid any health testing. Genetic conditions cannot be predicted accurately. Answer B. Explanation. To reduce the risk of passing on hip dysplasia, the breeder should have both dogs tested for the condition. Option B. This allows for informed decision-making based on the dog's genetic health and provides the best opportunity for producing healthy puppies. Simply mating the dogs, option A, without testing increases the risk of passing on genetic issues. Avoiding breeding, option C, may be appropriate if the tests show a high risk, but more important to test and make an informed decision. Skipping health testing, option D, is not advisable when breeding for genetic conditions. Question 25. Topic: Animal behavior. A cat owner notices that their cat is frequently scratching furniture and doors despite having multiple scratching posts available. What might be a reason for this behavior and how should the owner address it? A. The cat is likely stressed and the owner should reduce the number of scratching posts to avoid overwhelming the cat. B. The cat may be marking its territory and the owner should increase the number of scratching posts around the house. C. The cat is likely seeking attention, and the owner should ignore the behavior to teach the cat that scratching is not effective for gaining attention. D. The cat is not properly trained, and the owner should replace the scratching post with other toys to redirect the cat's behavior. Answer: B. Explanation. Cats scratch to mark their territory and release energy. If the cat is still scratching furniture, it likely needs more scratching posts. Option B. Placed in different areas, especially near where it has scratched before. This will provide the cat with more outlets for its natural behavior. Reducing scratching posts. Option A may make the problem worse by providing fewer places for the cat to scratch. Ignoring the behavior options might not be effective, as scratching is a natural behavior, not one driven by attention-seeking. Changing the scratching posts to toys, option D, might not address the root cause of scratching behavior, which is territorial marking or energy release. Question 26. Topic: Animal health and disease prevention. A veterinarian is concerned about a dog that has been diagnosed with heartworm disease. The dog is currently on a heartworm prevention regimen. What is the most likely explanation for this diagnosis? A. The dog was not consistently administered heartworm medication, or the medication was not effective. B. The heartworm disease is a result of the dog being exposed to a specific type of mosquito that the medication cannot protect against. C. The dog has developed a resistance to heartworm medications due to prolonged use of the same brand. D. The dog likely contracted the disease before starting the heartworm prevention regimen. May be possible to prevent the disease. Answer A. Explanation. If a dog is diagnosed with heartworm disease despite being on prevention, the most likely cause, option A, is that the dog was either not receiving the medication consistently or the medication was not administered properly. G. Missed doses. While mosquitoes are the primary vectors for heartworm disease, most heartworm medications are effective against all mosquito species. Option B. Resistance to heartworm medication. Option C is rare, and prolonged use of the same brand does not typically cause resistance. If the dog was on the prevention before being diagnosed, the disease would have been prevented. So the disease likely occurred before starting the regimen. Option D. Question 27. Topic: Animal reproduction and breeding. The breeder is concerned about the genetic health of their breeding program for a specific breed of dog. The breeder decides to perform genetic testing on both the sire and dam before mating. What is the primary benefit of this approach? A. Genetic testing allows the breeder to determine if the animals are genetically compatible, preventing inbreeding. B. Genetic testing ensures that the puppies will be free from all common diseases and health conditions. C. Genetic testing helps the breeder select mates that will produce offspring with the most desirable physical traits. D. Genetic testing can identify recessive genetic disorders that could be passed on to the puppies, enabling the breeder to make informed decisions. Answer D. Explanation. The primary benefit of genetic testing, option D, is to identify recessive genetic disorders that may be passed on to the puppies, allowing the breeder to make informed decisions and reduce the risk of inherited diseases. While genetic compatibility, option A, is important, testing is specifically aimed at detecting diseases and disorders rather than simply preventing inbreeding. Genetic testing does not guarantee that the puppies will free from all diseases or health conditions. Option B. Selecting mates for physical traits, option C, should be based on health and genetic health rather than just appearance. Question 28. Topic: Animal training. A professional dog trainer is working with a dog that is reactive to strangers and other dogs while on walks. The trainer uses desensitization techniques, gradually exposing the dog to controlled encounters with strangers and rewarding calm behavior. What is the goal of this training method? A. To teach the dog to ignore strangers and other dogs entirely during walks. B. To make the dog more aggressive towards strangers and other dogs to build confidence. C. To help the dog learn to stay calm and focused, reducing its reactivity to stressful situations. D. To punish the dog for its reactive behavior, teaching it to associate strangers and other dogs with discomfort. Answer C. Explanation. Desensitization, option C, aims to help the dog gradually adapt to its triggers, strangers, and other dogs by exposing it in a controlled way and rewarding calm behavior. This reduces the dog's reactivity over time, helping it stay calm and focused. Teaching the dog to ignore, option A, or avoid strangers and other dogs might not address the underlying issue of reactivity. Aggressive behavior, option B, counterproductive and would likely increase the dog's anxiety. Punishing the dog, option D, for its behavior may lead to fear and worsen the reactivity. Question 29. Topic: Animal welfare and ethics. A pet owner is considering adopting a rabbit but is concerned about the ethical implications of keeping a rabbit in a small indoor cage. What is the primary concern regarding animal welfare in this situation? A. Rabbits are nocturnal animals and should only be kept in cages during the day. B. Keeping a rabbit in a small cage limits its ability to engage in natural behaviors such as running, hopping, and digging. C. Rabbits are territorial animals and need their own space to feel secure even if the cage is large. D. Rabbits are low-maintenance pets and can thrive in small cages without much exercise. Answer. B. Explanation. The primary concern is that keeping a rabbit in a small cage, option B, limits its ability to engage in natural behaviors such as running, hopping, and digging, which are crucial for its physical and mental health. Rabbits are highly active and need space to explore. While rabbits are nocturnal, they still need space to move around during the day. Option A. Territorial behavior. Option C is not the primary concern. Comes to cage size, although rabbits do appreciate some personal space, low-maintenance pets, option D, can still require significant space and exercise to remain healthy and happy. Question 30. Topic: Animal health and veterinary care. A horse is displaying signs of colic including restlessness, pawing at the ground, and a lack of appetite. What is the first action the horse owner should take? A. The horse owner should immediately administer pain relievers to alleviate the symptoms. B. The horse owner should contact a veterinarian as soon as possible, as colic can lead to serious complications. C. The horse owner should withhold food and water until the symptoms resolve. D. The horse owner should allow the horse to rest and monitor its condition for a few days before seeking professional help. Answer. B. Explanation. Colic, option B, is a serious condition that can be caused by a variety of factors, including gastrointestinal issues. The horse owner should contact a veterinarian immediately to assess the situation and determine the appropriate treatment. Administering pain relievers, option A, could mask symptoms and delay necessary treatment. Withholding food and water, option C, without guidance from a veterinarian can worsen the whole condition. Monitoring the horse, option D, without professional help could lead to severe complications, including death.